So thanks everyone for joining this morning. I will talk about HIV prevention outreach in the 2020s. And, particularly in the 2020s before COVID, but I also have a few slides, during COVID, where some of these concepts may be very valuable, and talk specifically about Grindr, gonorrhea, and other STIs, and HIV PrEP. So these are my disclosures. So what about internet and sex? So we know that technology has changed the way MSM seeks sex. Now we know that over 90% of MSM have reported using the internet for information seeking and socializing, and 40 to nearly 100% of MSM use the internet to seek sex. But the internet remains really an underutilized recruitment tool for HIV prevention. But that's really something we still have to work on, to use the internet better. And identifying better ways of using the internet for HIV prevention may really increase the success of advertising strategies, in particular to recruit those people we really want to recruit to end the HIV epidemic. And these are hidden or marginalized high-risk populations that we don't reach otherwise. So what do we know about online partner seeking and transmission risk? And Tom Martin was leading this study, basically, or the analysis of this study that was done a couple of years ago within the within Susan Little's PrEP program. And we enrolled in the study 147 MSM with acute early HIV infection. And what we recorded were 20 HIV transmission events in the year following the infection. So we know that from those 147 MSM with acute early HIV infection, there were 20 HIV transmissions in the year following infection. And what we did is basically the time of diagnosis, we gave them a sex venue questionnaire within 3 weeks of diagnosis. One limitation, and that's something I have to mention from the beginning, is that this study was done a couple of years ago. So we did not go as much in detail in this questionnaire about venues and online venues as we would have done now. Nevertheless, I think what we found here in this molecular epi analysis was very interesting. Antoine Gelon helped a lot with that as well. So we found, first of all, epidemiologically and with the risk questionnaire, basically, that individuals who reported online partner seeking had increased risk behavior. But at the same time, we did not find an increased odds of inferred HIV transmission in the year following infection. And of course, you can argue, were we even powered to find something, but we did not even find a trend. But this was nevertheless, I think, very interesting findings in this paper published by Tom Martin in CID last year. So I already mentioned the increased risk behavior in those with online partner seeking, and we see here basically that any reported sexual transmitted infections were significantly higher, highly significantly higher, basically in those with online partner seeking and those without, 86% versus 56%, and above 5 sexual partners was basically also much significantly higher in those with online partner seeking, 46% versus 20%. So really higher risk behavior, but nevertheless, no increased risk of HIV transmission in the year after infection. And that's an interesting secondary finding at that time, because we also looked into the distance of zip codes of people within the transmission events. What we found is basically that those who did online partner seeking did not have a higher distance with their transmission events. With the sexual partners, it was 3.142 with the kilometers with their transmission events, versus in those without OPS, online partner seeking, it was 2.6. So really no different, and everything lower than the random distribution that would have been expected. So at the end, what we learned here, that even people who use online partner seeking find at the end people who live close by. And this is of course also explained by the nature of some of these apps, which are kind of like, very social and connected with people who are close by. So what about social media? And I think it's always very important to kind of like differ, because not all social media are the same, right? Social media networks are really always mostly reflecting offline social relationships. So Facebook, etc. Also Twitter, Instagram, etc. You're mostly friends, except for example, you're the Instagram really kind of like as a celebrity and for your living. otherwise you're mostly friends with people who kind of like, you're also friends with or connected with or with your colleagues in your offline life, basically. And we know in the US, social media use is at an all-time high with, 80% of Americans are on Facebook, over 80% of millennials checking Twitter at least once per day, and over half of Instagram users accessing the platform daily. Social networking apps are a little bit different. So first of all, they're different because the goal is different by people using these apps. Here, it's really kind of like the goal to network and to meet new people over this app. Grindr is, of course, the best example of this social networking apps. But overall, among MSM, we know that over 60% in the US use internet and smartphone apps to find sex partners. Dating apps are now the primary method to meet new sexual partners. And Grindr, as I said, is the most frequently used dating app in the United States, with 60% of MSM reporting at least some use, followed by other apps. And of course, many MSM would use not only one app, but 2 or 3 different apps to find sex partners. So it's not only one app. Basically, what do we know about Grindr and hidden populations? And let's start off with Latinos, because of course we know for the San Diego HIV pandemic, Latinos are very important just because we have kind of like, our whole population is kind of like, has a lot of Latinos, of course, because of our geographical location. And we know that 93% of Latinos below 50 years of age use the internet regularly, and above 70% of Latino MSM use the internet to find sex partners. So this is even more than among other ethnicities. And Latino MSM are among the most frequent users of Grindr. With almost half Latino MSM report frequent use of Grindr, which was more in one study than for Black MSM or white MSM. So really, Latinos seem to use Grindr a lot, while there's other apps like Adam for Adam that are specifically more used among Black MSM, for example. Okay, let me see if I can now continue. So my screen is kind of stuck. This is probably because not yet. But yeah, here we go. So what about Grindr and COVID-19? So this is always kind of like a question, because kind of like, when you think about geosocial networking apps, and especially, the lockdown phase in COVID-19 and generally finding a lot of new sex partners, it doesn't seem to be a great fit in terms of kind of like keeping, of course, COVID-19 numbers though. Of course, Grindr recognized that there would be a pressure and, they did something, but they stayed online, of course, so they offered the users, for example, a free access to a lot of different profiles, to look on different profiles, and recommended to stay home and chat safely, with lots of different people. But of course, the more profile access, the more likely you may also find, maybe somebody you want to meet up with. So it has, of course, both sides, and they did the social distancing startup back, so they did some innovative stuff, but at the end, the app was running and people were continuing to meet over the app, at least as much as before, I would say, from what we know now. So what do we know about MSM who use Grindr generally? So, from the studies that are published, we know that MSM who use Grindr have a greater frequency of condom-less anal intercourse, have a higher incidence of STIs, and more sexual partners, basically. And that's also in part what we found generally for OPS. But what's very important to emphasize, and that's kind of like very important to keep in mind, that meeting partners over the Grindr or over the internet or other geosocial networking apps may also facilitate protective behaviors. So we have the increased risk behavior, but at the same time, it may facilitate protective behavior like zero status disclosure, zero sorting, and negotiation regarding condom usage or discussion of sexual practices or user risk assessment. So that's the second thing, which, we also know in their studies that meeting people over the internet makes it easier to discuss these things. And what's really unknown is, how much is the use of pre-exposure prophylaxis impacted or affected by Grindr use and other geosocial networking use. And how much are these people who have more sexual partners and find partners over the internet, how much more likely, or are they even more likely to be on PrEP? So I have a few questions and I hope this works. So this is the first one where I just kind of like reiterate what I was talking about. So this question is, which of the following statements is true regarding geosocial dating apps? A, they are most reflecting offline social relationships. B, 1 out of 3 MSM is using social dating apps like Grindr, Adam for Adam, or Check. C, Black MSM are the most frequent users of Grindr. D, Grindr is the most frequently used dating app in the US with about 60% of MSM reporting some use. Or E, none of the above. And you can basically respond at the ball at this via internet or text your response. And I'll wait a bit, and maybe Marvin can kind of like instruct me on how long to wait and when to continue and move forward.
Yeah, let's give it a few minutes because it probably will take, let's try this first one, give it a couple of minutes.
You'll start seeing the responses immediately once they're in. Okay. So I'm trying to
just let me know. So I have a total of 4 questions basically during this presentation. The other 3 are at the end. So
no, this is great. It just, I think it takes people a few minutes to get it up. There we go.
So if people don't know, make sure you get your phones out, either go to the web browser and respond with that link, or you use that text chain.
Okay, so it seems like sometimes some people changed there because we had like some votes for B, which are gone now. Let's wait for a bit more. But I think this goes very clearly in the direction. This was very easy, and maybe I did a good job in kind of like telling you this message. Basically, you knew before, one of both, that D is the right answer. And thanks so much for participating. So we know basically D, Grindr is the most frequently used dating app in the US. And we know basically that it, as said before, Adam for Adam and Check for other apps that are used. Black MSM tend to use also a little bit more frequent other apps. And especially Latino MSM report very frequent Grindr use compared to other races and ethnicities. So that's so what were the objectives basically of our study? The objectives of our study that we did was to assess Grindr activity among MSM undergoing HIV and STI screening in San Diego, and examine how Grindr use correlates with risk prevention behavior, particularly focusing on PrEP use. And our study took place basically, and this study was done 2018-2019 at our total test, at Susan Little's total test at the AVRC Up, which kind of like, newly remodeled state-of-the-art HIV and STI testing facilities that also offer immediate treatment initiation for HIV and STIs, and also immediate initiation of PrEP. So basically what we did was a nested cohort study, as I said before, September 2018 to June 2019, among MSM receiving community-based HIV and STI screening in Central San Diego, with the free of charge Good to Go program. HIV point of care, what we are doing in this total test is HIV point of care rapid test, following by routine reflex to ID HIV NATS testing in persons with negative rapid test results, so we can diagnose acute infection. And can, pretty for sure rule out HIV infection in those who test negative. STI screening assessment includes syphilis with the reverse screening algorithm, but also chlamydia and gonorrhea with PCR of urine, pharyngeal, and rectal swab specimens with the Cepheid machine. And participants, basically, as I said before, who test positive for HIV or STI are offered immediate treatment at no costs, and those at substantial risk for HIV acquisition who test negative for HIV and are not currently prescribed PrEP are also offered immediate initiation of free PrEP since November 2018. So this did start a little bit later, not during the first 2 months of our study, but like 2 months later, basically, people were also offered immediate PrEP free of charge, kind of like the first month prescription free of charge. For our program. So what were the measures? During the testing encounter, we surveyed the participants for Grindr usage, and that was basically yes, no, have you opened Grindr on the mobile device during the previous 7 days. We also assessed demographics and risk behavior like substance use or sexual risk behavior during the previous 3 months. months. And we assessed PrEP use. There was also basically a yes, no with any PrEP intake during the last 14 days. In the subset of participants who had an iPhone and also had the iPhone with them at the time of the testing encounter, we also assessed Grindr on-screen activity, which is really, time on screen during the last 7 days, which is automatically recorded in the settings of all phones and easy to assess via iPhones. And those participants were asked to provide the data basically via the questionnaire. You can see here on the left an example here in the settings basically. And you'll see here kind of like, the time on screen, battery usage, but also the time on screen and time in background during the last 24 hours. And here you can click through the last 7 days, and then you see basically how much time people spent on Grindr on screen and in the background. This is something we could assess for a subset. In terms of risk categorization, and I talked about this before, so I'll just quickly walk over. We used our STIT score, Santiago Early Test Score, which is basically derived and validated in our early test cohort. In 2015, published first in 2015. In the meantime, it has also become validated in other cohorts around the world, including the Amsterdam cohort, where they also validated the STIT score last year. What's different basically, so we first, derived the score and validated the score in 2015. And what changed between 2015 and now is that back in 2015, we assessed risk behavior during the last 12 months before the testing encounter. But now we are assessing risk behavior during the last 3 months before the testing encounter. So what we have to do now for all our papers when we use the score is to adjust the STAT score. And that's also been done by other studies. And I won't go too much into detail there, basically, how we adjust it. But, for everyone who is interested, they can look into the slides or the publication, basically. And I will share those, of course, after the presentation. In terms of statistical analysis, we compared multiple things, including demographics, PrEP use, PrEP initiation, substance use, and risk behaviors, as well as these STAT scores. And also actual HIV and STI diagnosis during the testing encounter between those who reported Grindr use during the last 7 days versus non-users. And then we also did univariate and multivariable logistic regression analysis to assess predictors of initiating PrEP after the testing encounter. So this was for the subset basically for whom immediate PrEP was offered. And we assessed predictors what made people more likely to accept this offer and actually also initiate immediate PrEP with us. So coming to the results, basically of our study, we collected survey data from 1,256 consecutive MSM and transgender females and found basically that 46% of these participants indicated that they had opened Grindr during the last 7 days. So roughly every second person who tested with us opened Grindr the last 7 days. And in terms of demographic, the only significant predictor was really that the age played a role, basically, that people who with recent Grindr use were younger than those without recent Grindr use. So this was highly significant, while other demographics did not differ between the two groups. What about risk behaviors and PrEP use? So what we found is basically, not surprisingly, that those who reported recent Grindr use had significantly higher STAT scores, inferring significantly higher sexual risk behavior than those without recent Grindr use, driven by significantly more male sexual partners than those without Grindr use. Also a trend towards more condomless anal intercourse, more likely to have condomless anal intercourse in those with recent Grindr use. But what was interesting is that at the same time, self-reported PrEP intake within the last 14 days, and this is before our study or before our offer of immediate PrEP, it's just self-reported before they came to us, was also double as high among Grindr users than among those who did not use Grindr. So 18% versus 9%, highly significant difference. We also focused specifically on those Grindr users who were not on PrEP, because of course we wanted to see whether there's a potential to with Grindr to find people who are high risk but not yet on PrEP. And what we did is basically we found 472 of 1,087 participants who were not on PrEP, were reported recent Grindr use. So it's not just, it was 50% of people who use Grindr overall, but among those not on PrEP, it was 3%, so a little bit less, of course. But what we found is basically that even those Grindr users who were not on PrEP had still significantly higher sexual risk behavior, basically, than non-Grindr users who were not on PrEP. And the number of sexual partners among Grindr users not on PrEP was also significantly higher versus, non-Grindr users not on PrEP. So even in this subset, we know that, that there is potential. We found basically that also Grindr users who are not on PrEP have significant risk and may benefit from HIV prevention strategies and may benefit from outreach to promote HIV prevention because they're still high risk. Coming back to the complete study cohort, basically and looking into testing outcomes. So this is all people with Grindr use versus no recent Grindr use. And we found one surprising finding, and of course the numbers are low, you can argue, but testing positive for HIV during our testing encounter was significantly lower among those with recent Grindr use versus those without recent Grindr use. Again, kind of like, about 50% lower among Grindr users. While at the same time, testing positive for chlamydia gonorrhea was double basically among recent Grindr users versus those without Grindr use. So two very significant results going in opposite directions with lower HIV but higher chlamydia and gonorrhea test results among Grindr users. When we did our multivariate model looking into predictors of PrEP initiation through our program, we found that PrEP-eligible Grindr users were nearly twice as likely to start PrEP after the testing encounter compared to non-Grindr users. We know that Grindr users already were double as likely to be on PrEP when coming to us, but among the rest who were not on PrEP but PrEP-eligible, they were still double as likely to start PrEP basically with us versus non-Grindr users. So overall, 24.6% of Grindr users started PrEP with us versus 14% of non-Grindr users. And this was highly significant also in the multivariate model, where multivariate variable model, where recent Grindr use was a predictor, but also other factors were a predictor, like higher risk behavior, higher STAT scores, diagnosis of chlamydia gonorrhea during the testing encounter, and younger age. These were the other three predictors in the multivariable model to initiate PrEP via our program. I said before that for those people who had an iPhone and the iPhone with them, we also did this sub-analysis where we looked on on-screen activity. And overall, we had basically 376 MSM who reported recent Grindr use at iPhone users, of which 340 had their iPhone with them at the testing encounter. And the median on-screen activity during the previous 7 days was significantly higher in those who reported PrEP use within the last 14 days versus those who did not. So here you can see the median on-screen activity, 244 minutes in those with PrEP versus 104 minutes in those without PrEP. So if you see somebody on Grindr very frequently, chances are higher that they take at least some PrEP. Of course, we did not, in detail assess PrEP adherence, but that's basically what we found in our study population, significant difference. And you can see that, if you look on the interquartile ranges, this is really going up to 534 minutes during the last 7 days. So this is quite some time. So quite a much. And the top 10% of the top 10% of basically on the time on screen people, Grindr users basically had even above 660 minutes of Grindr use during the last 7 days. And what we found that these highest Grindr utilizers had also basically were more likely among those at highest risk for HIV with really, skyrocketing STAT scores that meet basically all our risk criteria, all our sexual risk criteria. So we found among those really, who had this highest sexual risk, it was a total of 25 people, 5 were also among the highest Grindr utilizers, which was significantly more, or a trend towards significantly more than among those with lower sexual risk. So what did our study really show? So our study showed, first of all, that Grindr users had higher sexual risk and were more likely to test positive for chlamydia and gonorrhea infections. Grindr users were also more likely to have taken PrEP within the 2 weeks before the testing encounters. And And a possible consequence, maybe, but maybe not alone because of PrEP, maybe also because of other safety behaviors among Grindr users. Grindr users were less likely to test positive for HIV. With only 9 diagnoses among Grindr users versus 26 new diagnoses among non-Grindr users. So there was a significant difference. And after testing encounter, Grindr users were still more likely to start PrEP through our program. They were also more high risk than those not using Grindr and not on PrEP. And they were more likely to start PrEP through our program if they were eligible for PrEP. So 25% of Grindr users started PrEP versus 14% of non-Grindr users. And Grindr use remained an independent predictor of PrEP initiation in multivariate analysis. Of course, there were multiple limitations as well. It was a single community-based testing site, thus it may not be, of course, general to other locations in population, especially other mixes of races and ethnicities in other places in the US. We did not collect data on usage of other geosocial apps like Scruff, Hornet, etc., which may be used in persons who have a high risk profile or had similar risk profile and bias. At the end, more likely the results between Grindr users and non-users towards the null. And the sub-analysis on on-screen activity was, of course, limited to iPhone users. And, you know, they may have a higher social and economic status, so it may not be representative of other cohorts who are not iPhone users, Android users, or don't have the phone at all. So what do we know from other places? And, you know, there's not so much recent literature on Grindr, basically, but one of the very recent studies is coming from China, where, you know, the situation is very different. And, you know, the motivation to use Grindr to find sex partners may be different in terms of kind of like, you know, being able to find somebody and not come into trouble with legal, etc. But what they did basically in their study, which was published, you know, I think 1 week ago or so, is they assessed basically, they enrolled basically over 1,000 MSM into either daily PrEP versus event-driven regimen PrEP. And this was not randomized, this was self-selected. And what they found in their cohort of about 1,000 people is that 74% reported primarily using geosocial networks like Grindr to seek sexual partners, which may, you know, in China also driven by other things than in the US. What they found basically in their study is that geosocial network users had higher risk behaviors, you know, similar to what we found with multiple sex partners and condomless sex than non-users. Geosocial networking users had also significantly lower level of pill counting adherence, and that was really kind of like a very interesting result here. So pill counting adherence was significantly lower among geosocial network users versus non-users. And in the on-demand PrEP group, geosocial network users had only a trend towards levels of lower levels of self-reported adherence, but lower level of self-reported PrEP coverage during sexual activity. So in the on-demand group, people were not able to have kind of like, you know, as high coverage during the sexual activity in the Grindr group versus the non-Grindr group, which may be explained also by the fact that they just had more sex, of course. Additionally, they also found that geosocial network users had a tendency to more likely switch from event-driven to daily regimen. So this is another thing where the safety behavior comes into place. So they had a higher tendency to recognize that maybe the event-driven approach with PrEP is not good for them, and they, you know, try to switch to daily PrEP instead to be really safe during their encounters. So when going back basically to our study, so at the end, you know, from China, we can see, and this is something we did not assess, of course, in our study, but PrEP adherence among Grindr users versus others may be something that's worth looking into. Of course, also, you know, adherence for on-demand PrEP use. Going back, what we did in our study, we found, of course, that the majority of Grindr users, you know, nearly over 80% were not on PrEP, despite having significantly higher sexual risk behavior compared to non-users. And we also found this greater acceptance of PrEP among MSM who use Grindr. And therefore, we concluded that Grindr may provide really a useful platform to promote HIV and STI testing and increase PrEP uptake. How to effectively deliver these messages and to really recruit people or deliver prevention messages via Grindr needs, however, to be assessed further. We know that there's the option to buy commercial Grindr banner ads, and I will go through the next slide through the literature and show that these really can be helpful for recruitment for HIV prevention efforts. That's also something we are doing in our total test, and we have been doing, and Marvin has been, you know, very much involved in doing that. And particularly, and that's also interesting, when we look into published literature, particularly among older MSM. So lots of these commercial Grindr banner ads specifically help recruiting older MSM. But what's of course important is that once you have the commercial Grindr ads that kind of like are the same for everyone, they may not really harness the social dimension of geospatial networking apps. So we really thought about ways how to do this more creatively and successfully use Grindr to recruit people. So going through the previous literature of Grindr and recruitment for HIV prevention, there were studies that evaluated Grindr ads for recruitment of HIV prevention among Latino MSM in Los Angeles, and really indicated that these ads can help recruitment for HIV prevention efforts, particularly among older MSM. We know basically that's from LA. We know that these apps basically, you know, can be targeted to certain geographic areas and zip codes, but not age group or ethnicities, because that would be something we would be very interested to specifically, you know, recruit, for example, young Black MSM or young Hispanic MSM, but that's unfortunately not yet possible with Grindr. We hope that this will be possible at some time. And I go back to basically show my from current slides. So, and there's also been a study, a very recent study from Australia, from Sydney, where they looked into Grindr ads for recruitment into a sexual health clinic over 18 months. And they also found basically that the Grindr ads were very successful in increasing attendance by new MSM, 70.3% increase of MSM versus 5.5% increase among new heterosexual men. So with the specific targeted effort of Grindr advertisement, they really could boost their MSM proportion. And average monthly rate of HIV tests increased among MSM, and also the proportion, as I said, of MSM increased significantly. So we know Grindr can help recruit in your clinic, and you know the easiest way is this, you know, commercial banner apps, and the most legal way is the commercial banner apps that Grindr offers for sale. And we know, of course, that's what I said before, banner ads can be targeted. So if you want to recruit from a certain geographic area and zip code, then you can use these ads to target those. But they may really be ineffective to reach hidden populations. And of course, they also cost money. So, and there have been previous studies that really have shown the effectiveness of network-based recruitment for locating undiagnosed HIV infections, but really few have dating apps to recruit hidden populations. And we've thought about ways how to potentially use these apps like Grindr to really recruit hidden populations, and came up probably that you need kind of like a more personalized delivery of prevention messages. Via, for example, advertisement on profile pictures, or selected opinion leaders who are really leading this. And when you think about opinion leaders on Grindr, of course, you know, the more people are online, the more people are seen. That's kind of like the one logic thing, of course. So we thought about, you know, what could you use as kind of like, you know, finding people who would be optimal for kind of like delivering these messages. And one thing is just the frequency of Grindr use, but maybe also one kind of like, you know, people who really meet people, because, you know, and people meet sex partners over Grindr, maybe people who meet many sex partners, because they may also be kind of like more reflective of opinion leaders. So that's kind of like what we thought around basically who to choose for these connectors. And what we also did is basically, when we thought about who would be kind of like the optimal person, we looked back into economy. And there's one interesting point which all economists know. I didn't know it before, really digging into that. And this is the tipping point, how little things can make a big difference. It's written by Malcolm Gladwell, basically published in 2000. And the tipping point is really defined as the moment of a critical mass, the threshold of boiling point, when basically, you know, something becomes viral. Do you know, really have to connect to virology. It's also the law of the few. The success of any kind of a social epidemic is heavily dependent on the involvement of people with a particular rare set of social gifts, or the 80-20 principle. which is the idea that in any situation, roughly 80% of the work will be done by 20% of the participants. And the optimal people, according to this economic concept, to deliver these messages or to really deliver these prevention messages or deliver these recruitment messages would be the so-called connectors, which are the people in the community who know large numbers of people and who are in the habit of making new introductions. So you have a huge social network, but then at the same time make new introductions. Like a network hub, that's something you can compare to. They introduce people who work or live in different cycles, and they are people who link us up with the world, people with a special gift for bringing the world together. So our thought was, and that's really something that has to be evaluated, you know, in future research, and anybody who wants to do this is invited to do this, of course. I would be very interested in the results, basically, to come up with, you know, some strategy where we, for example, provide, you know, testing vouchers via Grindr profile pictures or Grindr profiles of selected connectors, and offering basically an incentive when people use these vouchers to come for testing, and then, you know, do some blockchain recruitment where we recruit people who come from testing to recruit more, and, you know, very important, have an expiry date, because otherwise this could just be uploaded. But that was kind of like some of the ideas we had where we really could look into kind of like, you know, who would be the optimal connectors for reaching hidden populations. This would be kind of like an approach that could work and would be interesting to look into from a research perspective. Ads could look like this, basically, that people promote directly on their profile picture. The good news is basically, you know, with Grindr, you sign up with an email address, right? So they don't necessarily have, you know, all your personal data. That's kind of like the good thing. So this is something that could work, you know, and people could just set up again, theoretically, you know, if they wanted to, if Grindr would kind of like, you know, make some problem or didn't want this advertisement. But overall, Grindr is very much into HIV prevention. So, you know, it's something that would need to be seen whether or not Grindr would kind of like, you know, do something against such sort of advertisement. So coming basically, you know, towards the last parts of my presentation, I have again a polling question, basically, you know, summarizing what I said and before coming to the conclusions. So basically, MSM who use Grindr, social dating apps are A, more likely to test positive for HIV, B, exhibit fewer protective behaviors such as zero status disclosure, discussion of sexual practices, and user risk assessments. C, have a higher incidence of sexually transmitted infections. D, are less likely to have taken any HIV pre-exposure prophylaxis in the previous 14 days, or E, all of the above. And thanks so much for voting. And I'll wait a bit. These questions are kind of like...
Martin, can you see where it says how many people have voted? Does that come up on your screen? Okay, good. I
see the percentage. I don't see the absolute numbers, but I see the percentages switching. So I see that now it's 90% and 10%. So you know.
Yes, we can see that. I meant, can you see how many people actually put their votes in? You know, so is it 3 people?
That's something I can't see. I can just see the percentages. But
okay.
With 90 and 10, I think it's at least 10 people, I would say. Okay.
Yes, I like that. That reasoning makes sense. I'm with you.
Yeah. So I think it's also going in a very clear direction, which makes me, of course, very happy because C is the right answer here. We know they have a higher risk of incidence of sexually transmitted infections. We don't know, of course, that they kind of like have a higher risk of acquiring HIV, have a higher risk of transmitting HIV, because they may also have higher, you know, protective behavior and safety behaviors. And we know that they have also kind of like a higher PrEP use. And also even those who are not yet using Grindr, also more willing to use PrEP. So this is kind of like really which makes Grindr users very interesting for us in the HIV and STI world, of course. Next question is, which of the following was a predictor of initiating immediate HIV PrEP after HIV STI testing encounter? And this was in our model basically Grindr, A, Grindr, social dating app use, B, diagnosis of chlamydia or gonorrhea infection, C, more sexual partners and unprotected sex, D, younger age, or E, all of the above? Votes are coming in now. That's great. And again, this is going into a very clear direction. So thanks so much for voting. I'm very happy about the responses. All of the above. Here is also the right answers. So PrEP eligibility twice as likely to start PrEP after testing encounter. But there were other predictors as well, including higher sexual risk behavior, incident STI, and younger age in our model. So last question, basically, Grindr, DM, and other social dating apps could serve as platforms for education and HIV prevention outreach. Which of the following statement is not true? A, commercial Grindr banner ads can help or has helped recruitment for HIV prevention efforts, particularly among older MSM. B, Grindr banner ads can be targeted to certain geographic areas. C, Grindr banner ads can be targeted to certain age groups. D, a more personalized delivery of prevention messages, so for example, via opinion leaders, could show promise to reach hidden populations. And it's about which one of those is not true. Okay, I will wait a little more. Okay, so finally, okay, I'll move on. I think, all are true has the overwhelming majority here. But here, basically, I think it's important that that's, I'm happy to kind of like, we can kind of like emphasize again this message. So what can't be done, what you can do is you can really target Grindr ads to certain zip codes. But we can't really target Grindr ads to certain age groups. As far as I know, maybe this has changed very recently, but this was kind of like not possible. That you can say this is only going to people, below 25 years of age. But maybe Marvin has more news and, maybe you're right and I'm wrong. We'll see afterwards. But that's kind of like, at least my last knowledge. And that would be something we always looked into, kind of like something we would have loved to do, to use Grindr to specifically recruit young MSM. But mostly often kind of like, it really, not all MSM you recruit with them are young, and often it's even more effective to recruit older MSM than young MSM. So coming to the conclusion, basically, of my talk, over 60% of MSM in the US use internet and smartphone-based geospatial networking apps to find sex partners. Grindr users take more risks, but at the same time also more open to HIV pre-exposure prophylaxis. And future studies really should assess PrEP adherence using objective measures. So we saw this one study from China, but of course we need to have studies from the US, basically looking into PrEP adherence optimally, using really objective measures like, DBS levels, to really measure PrEP adherence. And also on-demand PrEP would be something that would be interesting to assess, of course. And Grindr could be an effective vehicle for reaching people at risk for contracting HIV or other STIs, could be used to promote HIV and STI testing, educated those at the highest risk for HIV about benefits of PrEP, and link users to programs that offer PrEP. So all of this could be done via Grindr in HIV prevention in the 2020s, and specifically, also, after the whole COVID pandemic, kind of like, we have a vaccine available. So this is not, as big as it is currently now. So, and with that, I want to thank you for your attention. We have a couple of minutes still for some discussions. So I'm looking forward to your question. Probably there are also already some questions. Children know better because I had the chat off. So thanks so much.
Martin, thank you so much for this really great talk. It's really an important thing to start to hear about what, you know, what's really happening out there. The use of Grindr's obviously, you know, grown so much in size, and obviously a, you know, huge dating app. Thanks for all of this information. Surprisingly, the chat was kind of quiet. And I didn't get any questions to me or to everyone. I have a question, but I'm gonna see if anyone wants to unmute and ask a question to Martin first.
I just see keeps going.
For those who aren't looking at the chat, our very own Chip Schooley said we have no questions because everyone was on Grindr. I can start it off, Martin. I know that this talk was very much focused on men who have sex with men.
Yes.
My question sort of shifts into the transgender population, and wondering what kind of data you have in that arena. I'm well aware that a lot of transgender and non-binary individuals all use Grindr very frequently, and I wonder how much of this data is overlapping because they're being captured as MSM, and what you know about that, and any thoughts in that arena.
Yes, I think, you know, in terms specifically, we had, unfortunately, we had a very low number of, you know, transgender. We did not exclude transgender from this study, but it was very low. So it was, you know, not. So what we found in our small cohort, basically, is that many transgender did not. So there were not a higher proportion among transgender who used Grindr. I think it was slightly lower than among MSM. That's what we found. So there may be kind of like, you know, other methods, and we know there's multiple different methods, but we know, for example, also for substance users, you know, not saying that, you know, this is kind of like, you know, it's again a different population, but we know kind of like, you know, for meth users, for example, that they often also use kind of like other methods. So Grindr may not be kind of like, you know, very highly used among meth users because they want to use something where they kind of like can talk more open about, you know, and basically the, you know, party and play, etc. So that's kind of like when it goes into subgroups, Grindr may not be kind of like the optimal app for all different subgroups. And I also don't think that Grindr would be kind of like the optimal app if you really kind of like want to look something into transgender. But I'm not aware that there's like one single app basically that, you know, is most used among transgender. But that's as sad, you know, I don't have kind of like, you know, a systematic approach or kind of like a relatively huge end study to really kind of like prove my assumption. It's just from our small, you know, subcohort that, you know, we're transgender in our study. So
right. Yeah, and in some focus groups we've done, and basically from patients, they tell me that they use Grindr quite a bit, but obviously that's not a study. But thank you, that's great. There actually are a couple more questions now. I don't know.
Just to add, you know, once you really approach from the STI perspective, you know, I mean, I think there's also literature on Tinder, basically, you know, for heterosexual STI, there's also literature on Tinder. This would be, of course, more STI focused, especially in San Diego, where we don't have a lot of diagnosis of HIV among heterosexual people. But yeah, sorry, go ahead, Jill.
No, it's fine. I don't know. I don't know if you can see the chat now. I'm happy to read it to you. Anik Bork has asked, she said, you might have already said this, but what's the hypothesis for Grindr users having lower HIV prevalence? Is it more serosorting, strategic use on condoms? And again, aside from their higher PrEP use, but any other thoughts?
Yeah, so I think thanks so much, Anik. I think that's also kind of like a very interesting point. I don't think that, you know, we haven't modeled this, but, you know, this 20% versus 10% PrEP use without any adherence is not the only driver for this. You know, that's something I'm pretty sure, right? So I think there must be something else, as you also pointed out, in addition, at least, you know, that really drives this difference in terms of kind of HIV, testing positive for HIV and having incident HIV infection. I think, you know, it could be all sort of safety behaviors. We did not assess this, unfortunately, in our study in detail, but serosorting, you know, probably more likely than condom use maybe. But serosorting definitely is something that, you know, or maybe also planning out kind of like more in detail, basically, you know, what to do and what not to do, or anything like that, basically, could come into play. But yeah, that's definitely. But I think it would be very interesting to look into that further, and, you know, do some maybe qualitative or quantitative analysis and look further into like what drives this difference, and what, you know, what is the difference between Grindr users meeting sexual partners and non-Grindr users meeting sexual partners in terms of safety behavior. So that's kind of like would be really something that would be interesting to look into.
And Jeff Taylor just added, in addition to zero sorting, also zero positioning, which is an important.
Yeah. Very good, very important point.
Yeah. Aaron Wilcott asked, I think, a great question, because I don't think you got so much into it because it's perhaps hard to assess with what you did, but he said he sees a lot of young patients shifting away from Grindr to more lucrative fan-based sites like OnlyFans or Just for Fans, where they're negotiating transactional sex with members or followers. First, just to build on what Aaron said, you know, is that something that you explored at all in what you did with Grindr? But then also, are there opportunities for PrEP and or STI screen outreach to other social apps?
Yeah, so definitely. So basically, we haven't looked into that basically, you know, and this is also kind of like rapidly changing field, right? So that's kind of like very important. I mean, you know, between the first study I presented, which we did kind of like in 2015, you know, in 2019, we had another world, 2018, when we planned out the study. And now the world, you know, is changing again, basically. And I definitely think, you know, I would have to look further into the technical details, but, you know, especially, you know, these OnlyFans, Just for Fans, you know, and, you know, kind of like, which kind of like is more a reward driven approach with kind of like, you know, especially having people who are more popular, you know, and if you could win over, you know, some of these more popular people, of course, you could have a huge impact, you know, in terms of PrEP or STI prevention. So this could be definitely something I could think of, you know, if you could win these people, you know, to help you kind of like, you know, and help themselves as well, you know, as part of that. That would be definitely something that could be a very interesting approach. So.
Martin, I also think, just to add, I mean, obviously these studies were done in the last couple of years, but COVID really has affected a lot of people, including, you know, loss of employment. And I think a lot of us have patients who have shifted to transactional sex work to make some money because they don't have their jobs. And it would be something interesting to perhaps look at, you know, going forward, particularly in this new era of job loss or high job loss.
Yeah, 100%, you know, especially with young people, you know, losing their jobs, you know, I think from that point, it will be interesting. At the same time, we know, you know, once the bars are closed, people have to find sex partners somehow, right? So, you know, what I assume, you know, of course, we hope that people kind of like, you know, practice some more social distancing, but at the same time, much more of the sex partners meetup was for sure done via the internet and via social networking apps, or is done during these times. So, yeah. So that's the other part, of course. So it's kind of like, you know, it's definitely not becoming less important as a venue or as a venue for outreach than it has been before. So.
Well, thanks, Martin, so much. There are no other questions. I think this gives everyone a couple of minutes to debrief in their minds. This was such a great talk. Thank you so much. Thanks, everyone. Have a great and safe weekend. Martin, thank you so much.
Much for everyone. Thank you.
Bye,
Thanks, Jill. Thanks, Jill, for moderating. Thank you so much.